Martin Luther King said of all of the inequalities in America, inequality in healthcare is the most shocking and most inhumane. So I think that's a good place to start. I don't talk about inequality, I talk about inequity. Inequality means people aren't getting the same thing. Inequity means people aren't getting what they need. And it's interesting because a lot of our work with the eHealth Advisory Board has been about inequality. It's been about recognizing, okay, how do we not give everyone a one-size-fits-all approach to figuring out how to shop for health care services? How do we help them how do we give them what they need? Right. And what you need may be different if you're an older Black woman in New York City than it is if you're a white gentleman living in Texas. Just in terms of the resources that are available, the physician groups that are available, the way we need to talk to people. We want eHealth to help people shop by understanding, are you addressing these social determinants of health in addition to traditional health care? Are we really looking at health care versus sick reimbursement? So I think it's important for people to understand that there are different ways that we can leverage the tools, the resources, the people, the partners around us to improve health. 80% of your health happens after you leave the doctor's office. It's not the hospital or the clinic, it's transportation, it's food, it's childcare, it's internet access that we're all using right now. That's a privilege. It's a privilege because we don't even think about it. But there are so many people out there, particularly in rural areas, who couldn't even participate in this session that we're having right now because they don't have internet access. So those are the things I think about when I think about health equity. 4 years ago, my kid said to me, "Dad, you're Black history," and it was both funny and it was a powerful moment to me, thinking about the fact that I'm just the second African American male ever to serve as Surgeon General of the United States. I grew up straight A's, never believed I could be a doctor because I'd never met a Black doctor in my life. And so representation is important. You have to see it to believe you can be it. And you all are all leaders. So I hope when you're looking at your leadership teams, when you're looking at the people around you, you're seeking to increase diversity, not just because it's the right thing to do, but because studies consistently show that when you have a diversity of opinions at the table, you're less likely to miss something. You're more likely to be optimally productive. You're going to have a better work product at the end of the day. Your company is going to do better if you have a diverse team.